Welcome to the Northern Laser Vision Centre. Approximately 45% of Australians rely on glasses or contact lenses for clearer vision. This is a practical solution to correct vision, especially if your eyesight is changing over time. But for people who have stable vision, glasses and contact lenses can be inconvenient and restrictive, especially if you have an active sporting life or a demanding career.
When I came out of the surf, trying to find my towel, that sort of thing, I'd have to pull out the glasses, fumble around, try and find them.
And being a golfer and enjoying a bit of golf, I found that all of a sudden I was starting to find the glasses were getting in the way.
If your eyesight is not as good as it should be, why put up with it? The good news for most people is that you don't have to. Laser vision correction is being used all over the world to improve people's sight.
A guy had just had it done and had the bandages taken off and he could see, and he had this amazing look on his face, and I thought I'd really like to try and have the laser surgery done.
The Northern Laser Vision Centre is dedicated to providing better vision for you so that you can enjoy a better quality of life and see your way more clearly.
Dr. Frumar at Northern Laser Vision Centre is just wonderful. The service that you get is just great.
I have been seeing Dr. Frumar for a number of years for ophthalmology, and I trusted him.
My sister had heard about Dr. Frumar, and so I came to see him.
His techniques during the operation was great, the reassurance was good, the follow-up has been fantastic. I've always felt comfortable with him.
Dr. Kim Frumar is the Medical Director here at Northern Laser Vision Centre. He's a former chairman of ophthalmology at the Sydney Adventist Hospital, is a consultant ophthalmic surgeon at the Royal North Shore Hospital, and is the visiting ophthalmic surgeon at Dalcross Private Hospital on Sydney's North Shore. He has over 20 years' experience working with ophthalmic lasers in various aspects of eye surgery.
Thank you for watching this presentation. It will explain to you the techniques that we use here at the Northern Laser Vision Centre to improve your eyesight the safe way. You don't have to put up with eyesight problems anymore. Our aim is to provide better vision for you so that you can enjoy a better quality of life and see more clearly.
Like a camera, the eye works by focusing light. When you cannot focus light properly, you need glasses or contact lenses to assist you. The main components to consider in this cross-section of the eye are the cornea, the clear curved front part of the eye, or the natural lens, and the retina at the back of the eye. With normal vision, light passing into the eye through the cornea converges to a focal point on the retina, where there is clear vision. The retina then transmits information to your brain via the optic nerve, where sight is then perceived. People with short-sightedness or myopia comprise about 1/3 of the Australian population. It occurs when light focuses in front of the retina. Glasses with a concave lens correct this problem. Long-sightedness or hyperopia is when people have the ability to see clearly in the distance but not up close. It occurs when light focuses behind the retina. Glasses with a convex lens correct this problem. Astigmatism is when your vision is constantly blurred. This is caused when your cornea is irregular in shape. Instead of light rays focusing at a single point, they focus at a number of points. Astigmatism can be difficult to correct with glasses.
The good news is that these problems and others can be corrected by laser eye surgery. The technique I use at the Northern Laser Vision Centre is the highly successful New-Laser Epilift technique. This is the next generation development in eye laser surgery, combining LASIK and epi-LASIK. Other centres like ours use a technique called LASIK or intralase, which is performed under a flap that is cut and lifted off the deeper layers of the cornea. We no longer use this technique. Because New-Laser Epilift does not cut the cornea, there is no weakening of the cornea. We have found New-Laser Epilift is safer and gives far superior results over the long term.
new laser has become our procedure of choice for a number of other reasons. New laser Epilift gives excellent visual outcomes. Studies have shown that night vision symptoms are twice as bad with LASIK compared to new laser. It has outstanding safety and predictability. 97% of our patients see as well or better after surgery without glasses than with their glasses before surgery. New laser has less risk involved with the procedure itself compared with LASIK. There are in excess of 32 possible flap complications with LASIK. These are completely avoided with new laser Epilift. More evidence is coming to light that the loss of strength to the front of the eye after LASIK treatment caused by cutting and thinning of the cornea will cause long-term weakening to the eye with progressive changes to your vision later in life. The dry eye problems caused by LASIK are significantly worse than new laser. Because the cornea is cut with the LASIK procedure, it remains numb for 12 months or more. With some patients, it can become permanent. With the new laser procedure, the cornea is not cut and dry eyes have typically resolved within 4 to 5 months. Compared to LASIK, this is a great deal shorter.
To start with, I went home and slept, but the next day my eyesight was like I was wearing my glasses. It was 100%. It was wonderful.
Afterwards, yeah, there's a little bit of discomfort, but it's definitely all worth it.
Very few people are unsuitable for laser eye surgery. There are, however, a few guidelines to consider. You must be 18 years of age. You must have had stable eyewear prescribed for at least 1 year. Unfortunately, you cannot be treated if you're pregnant or breastfeeding. And you should have healthy corneas. We'll advise you of this during your eye examination. If it turns out you are not suitable for laser eye surgery, Dr. Frumar will discuss other alternatives with you that may help get the visual outcome you desire. On the day of procedure, there are a number of helpful hints to note. Please don't wear eye makeup or perfume to the clinic on that day. We suggest you wear loose, comfortable clothing. Try to organise somebody to pick you up once your surgery is finished. You'll be given a light sedative during the procedure, so it will not be safe to drive yourself home. If this becomes a problem, let us know, and we'll organise transport for you. If you are clinically suitable, we'll treat both eyes on the same day. Once our treatment preparation is completed, the actual laser procedure usually takes 20 minutes. The procedure begins with sterile surgical taping of the eyelids. They are then kept open with a speculum. The eye is cooled with eye drops and a suction ring attached. This may make your vision go a little grey. A separator is then used to automatically peel back the surface skin, the epithelium, without cutting the cornea. You'll notice that the surface skin has been pushed to one side and then the eye is sponged to keep the exposed area sterile so that laser vision correction can begin. After the laser correction is complete, the skin or the epithelium is replaced like a band-aid over the cornea to promote comfortable, rapid healing. A contact lens is then placed over the eye to hold the flap in place, allowing it to heal with minimum discomfort. It will remain in place for 3 post-operative days. Eye drop medication is also used to promote healing. The Northern Laser Vision Centre strives to offer our patients the highest quality, care and safety. For this reason, we use the Zeiss Meditech MEL80 laser, currently the fastest laser on the market. It incorporates a phenomenal eye tracker which checks the alignment of your eye 250 times per second. This ensures that the energy of the laser is delivered in a smooth, accurate and safe way. It reduces surgery exposure time, giving faster recovery after the procedure. As part of your decision to have laser eye surgery, you must also be aware of some very small and infrequent possible risks, complications or side effects. For instance, some people are sensitive to sunlight and glare following surgery. You may also experience haloing around streetlights or car headlights. These are common symptoms and are very short-lived. There is virtually no pain during the new Laser Epilift procedure.
There was a little bit of discomfort at one stage, but there wasn't actually any pain.
Yeah, well, there's definitely no pain whatsoever during the surgery. I was really surprised. You just have to look up at a flashing red light, just keep your eyes still, which was a lot easier to achieve than I thought.
It's not painful as such, it's more uncomfortable.
Occasionally, people do experience pain after the procedure, but this is usually helped with the pain tablets you'll be given.
There was some pain and discomfort that did go on for a few days afterwards, but what's a few days compared to not having to wear glasses or contact lenses for years.
You'll probably experience watering eyes and swollen eyelids during the initial post-operative period, but this will be short-lived. Infection is very rare, but we will give you antibiotic drops both during and following your surgery to minimise the risk of this.
The freedom from your spectacles or glasses is just wonderful.
But I found the quality of distance vision was the first thing. That was just phenomenal.
I see so many other people now with glasses on, and I think, why don't you just go and have a look at getting laser surgery for yourself? And they obviously don't understand the benefits. But lifestyle-wise, I'm wrapped.
All patients are seen the day after surgery and their vision checked. We recommend you take that day off work. We then recommend another vision check 3 days after this. Your vision may not be 100% for 1 or 2 weeks, but we feel that the slower recovery time experienced with new Laser Epilift is far outweighed by its improved safety, stability and accuracy.
And within 24 hours from there, I was starting to see things, and every day was a new awakening, with more things becoming clearer. The clarity was getting better, and even today it's fantastic.
I was wearing glasses for short-sightedness, and now I've just thrown them all away, and it's fantastic. My toddler can't break my glasses anymore.
Laser eye surgery is changing the lives of thousands of Australians, making them less reliant on their glasses or contact lenses and greatly improving their lifestyle. We have tried to give you a broad picture of all the advantages, complications and risks associated with laser eye surgery. It is not our intention to frighten you, rather provide you with quality information so that you can make an informed decision as to whether to go ahead with this exciting procedure.
Probably the hardest thing pre the surgery is just your worry about the surgery, just the nerves that you have, because your eyesight's a big thing.
But once I got here, once we went into the room, got all set up, everyone just made you feel at home.
And I was amazed. No pain at all during the surgery.
It's the best vision I've ever had.
Thank you for taking the time to watch this presentation. This is exciting surgery that can have an enormous impact on your life. Don't put up with glasses or contact lenses any longer. You too can look forward to improving your vision the safe way at the Northern Laser Vision Centre.